Hi, my name is Dr. Selma Lemois. I work at USF Bulls Country Pharmacy and I'm the pharmacy manager. I chose to become a pharmacist because when I was in university, I like chemistry and I didn't know what path to take. So I had the opportunity to shadow a pharmacist at a community pharmacy and I really like it and just follow that career and I'm here. About the degrees, I have a bachelor degree in pharmacy, my PharmD that I finished after my bachelor's, and just recently got my board certification in geriatric pharmacy and my certification in HIV. Always been in community pharmacy, so I've been pharmacist, floater, and now pharmacy manager. I've been corporate in different corporations like CVS, Publix, and now I'm working at the university. Like you guys know, it's a little, it was difficult, but we made it. Yay, I'm here. But it was different. When I graduated, we still were in the bachelor, but my school was one of the last schools to have the bachelor degree. So we were in that transition of having the PharmD program. So we had a lot of classes of the PharmD program, but we were not accredited for PharmD yet. So it was interesting because we were like pioneers helping them with the classes. And then after that, I had the opportunity to finish my post-bac PharmD program. There were few universities that were offering that kind of program because it was specifically for students that had a bachelor that wanted to achieve the PharmD. So I had the opportunity to be accepted at NOVA and I finished the program. During my career that I remember, I would say immunizations. Immunization started when I was like 3 years in practice, and it was the transition of us getting used to the immunization and the patients getting used to the pharmacists doing immunizations. And I think it was a good opportunity because we see patients all the time, and it is still a good opportunity for us to offer immunizations to the patient and have that important part in their health. Right now, my responsibility besides the regular pharmacist job of checking and transferring prescriptions and calling doctors are more management type of responsibilities. Like I have to do protocols if we're doing something new. I work with the clinic, so if we're doing something integrative, I have to work with them. Management here, hours, budget, all of that. Both. It could be for pharmacy or it could be in regards of the medications that they have at the clinic. If I have to help them either with their formulary, if they have medications that have had problems, or it's usually more formulary to make sure that we have the medications that are needed. And if I find either something cheaper or with less side effects or things like that. So it's more, it will be more like a P&T committee, like a pharmacy and therapeutics committee. Here, I have the opportunity that I work with USF Health, Student Health Services. So I am part of their team of professionals, and like we go to meetings and I'm part of that team of providers. Usually the providers are like physicians, nurse practitioners, PAs, I think physical therapy is there, and pharmacy. not all of them, but like an example, if they write for certain medications and the medications are not covered by the insurance, I can change it. I can give an example of different inhalers, like the different like albuterol inhalers. Sometimes they specifically write for an example Ventolin, but the insurance wants ProAir. Some of the providers have given me the opportunity to do that change. Right now, I think the challenge is getting the provider status that I know is changed to a collaborative practice agreement, which I think it will be more or less like what we're doing over here. And I know that's what we are looking forward to be doing as a profession. Working more with providers to make sure that the patient is getting the right medication and the right therapy that they need for their health.